name is Kayla. I'm going to be your nurse today. I'm here to just do a quick head-to-toe assessment. So after hand hygiene and introducing myself, I'm going to acknowledge any visitors that are in the room. And in this case, there are no visitors or family members in the room. Then I'm just going to assess for safety. There's no clutter on the floor that my patient could trip on. The bed is in the lowest position and only 2 side rows are up, so that is appropriate for my patient. My patient's name is Mizelle, and his birthday is 5/11/1974, and his medical record number is 1234. Can I see your wristband, please? Can you please confirm your name and date of birth?
Mizelle, 5/11/74.
Okay, and his medical record number on his wristband is also 1234. Now, do you have any allergies I should be aware of?
Penicillin.
Okay, so I'm going to make a note of that in his chart just in case it's not already in there, so we don't get any medication mix-ups. I'm going to look at the general appearance of my patient. His skin is pink, warm, dry, and intact. His breathing is non-labored, and his airway is open and clear. His speech is clear and coherent, and he's alert, awake, and responds appropriately to communication. I'm now going to go over your vital signs with you real quick just so that you're included. Your blood pressure is 156/76. It's a little high for the top number. We like it to be around 120/80. Your temperature is 100.4, so that's right on the brink of a fever. We're going to keep an eye on that. And then your respiratory rate is 20. We like that to be between 12 and 20. So you're still in range, but it's just a little bit high. So we're also going to keep an eye on that. But all of those things could be due to the pain you're experiencing from your kidney stones. So that's okay for this situation, but we're still going to monitor them. Your oxygen is 96%. We'd like it to be above 95%. So that's okay for now. We're going to keep monitoring that as well. And then your pulse rate is 88. We like that between 60 and 100, so that's right in the middle. So you're all good there. Now, are you currently in any pain?
Yes.
Okay, when did that pain begin?
A few days ago.
All right, and where is that pain located?
My side, back, and lower abdomen.
Okay, and is it a come and go pain or is it a constant pain?
It comes and goes.
Okay, is the pain sharp, dull, burning?
It's sharp and dull, and it burns when I urinate.
Okay, is there anything that makes the pain worse?
Movement, any type of movement, or when I urinate.
Is there anything that makes the pain feel a little bit better?
When I relax or lay down and I don't have to go to the bathroom.
Okay, were you taking any treatment at home for the pain?
Tylenol.
Okay, and how many milligrams were you taking?
600.
Okay, so I'll make a note that my patient was taking 600 milligrams of Tylenol at home to treat the pain. On a scale of 0 to 10, how would you currently rate your pain?
A 5.
Okay, so I'd also make a note of that in my chart. My patient's pain is currently a 5 after the pain medication he received 4 hours ago. Now I'm going to assess for any tubes, drains, or equipment that could be in the way of my head-to-toe assessment. And there's no tubes, drains, or equipment connected to my patient, and there's none in the way. So I'm going to go ahead and raise the bed up to waist level and then begin my head-to-toe portion of the assessment. Do you know where you're at right now?
I'm at the hospital.
And do you know what day it is?
December 5th.
Okay, so my patient is alert and oriented. Time for you to press the place in time. Could you go ahead and smile for me? Stick your tongue out and then raise your eyebrows. Okay, facial symmetry is noted and he has a relaxed expression. Could you go ahead and open your mouth again for me? Okay, mouth is pink and moist. And are those your real teeth or are they dentures?
Real.
Okay, my patient has his real teeth and they are intact. Now, are you having any trouble swallowing?
No.
Okay, my patient is having no trouble swallowing. Could you go ahead and stare at the wall for me? I'm just going to shine this light in your eyes real quick. Okay, pupils are equal, round, reactive to light, and 4 millimeters in diameter. Could you stare at the wall again for me?
Okay.
And then stare back at my finger. Okay, pupils are accommodative to distance. And now I'm going to move down to chest. So I'm going to first ask if he's having any trouble breathing or any pain. Are you having any trouble breathing or any pain in your chest?
No.
Okay, and then I'm going to look for bilateral symmetry. Can you take a deep breath for me? Okay, chest expansion is bilaterally symmetric. Now I'm going to listen to my patient's breath sounds anteriorly, laterally, and posteriorly. So just take some normal breaths for me, okay?
Okay.
Okay, then sit up for me. Okay, breath sounds are clear and no adventitious sounds are noted. And in order to listen to the breath sounds and the heart sounds, I would pull the gown down so that my stethoscope is on bare skin to get a better sound. Now I'm going to listen to the heart at Erb's point, and usually I would listen for a complete 60 seconds, but for the sake of the video, I'm going to listen for a shorter time. Okay, S1 and S2 are present and no murmurs are heard. So now I'll pull my patient's gown back up for privacy, and then I'm going to move down to the abdomen. I'm going to look for abnormal contour or any distension, dressings, drains, wounds, or lesions. But I would pull the gown up in order to see that and still promote privacy. There's no dressings, drains, wounds, lesions present. There's no signs of infection, and my patient's contour is flat and there's no abnormal distension. So now I'm going to listen to bowel sounds in all 4 quadrants, starting the right lower quadrant. Okay, bowel sounds are normal, active in all 4 quadrants. Now I'm just going to feel on his stomach for any tenderness or firmness, and then I'm going to ask you a few questions while I do so, okay? When was your last bowel movement?
This morning.
Okay, when was the last time you urinated?
15 minutes ago.
Okay, are you experiencing any nausea or vomiting?
No.
Okay, and how's your appetite?
It's good.
Would you say your diet is normal? You eat 3 meals a day?
Yes.
Okay. There's no tenderness or firmness noted in the abdomen, and then I'm going to pull the gown back down, again, to promote privacy. So now I'm going to move on to the upper extremities. My patient's skin on the upper extremities is pink, warm, and dry. There's no lesions noted. And are you experiencing any numbness, tingliness, or weakness in your arms?
Mm-mm.
Okay, can you go ahead and raise them above your head for me, and then put them back down? Okay, my patient has full range of motion in the upper extremities. Now I'm just going to test for edema. Okay, there's no edema noted. Now I'm going to feel for your radial pulses. Okay, radial pulses are strong and equal bilaterally. And now I'm going to test for capillary refill bilaterally. Okay, capillary refill is less than 3 seconds. Now can you go ahead and squeeze my fingers for me? Okay, patient's grip strength is strong and equal bilaterally. Now I'm going to move down to the lower extremities. I would pull my patient's pants up to see the legs, but for privacy I'm not going to do that. Skin is pink, warm, dry, and there are no lesions noted. And now I'm going to test for edema. Okay, there's no edema. Are you having any numbness, weakness, or tingling in your lower extremities?
Mm-mm.
Okay. Now could you bring your knees up to your chest for me? And then put them back down. Okay, can you raise your right leg and put it back down? Raise your left leg, put it back down. Okay, my patient has full range of motion. And then can you go ahead and push against my hands for me? Okay, patient has good foot strength, and then I'm going to test for capillary refill. Okay, capillary refill is less than 3 seconds and equal bilaterally. Now I'm going to test for pedal pulses. Okay, pedal pulses are strong and equal bilaterally. Now, could you go ahead and roll over on your side for me? So now I'm going to look for tissue integrity. I'm going to check all bony prominences for any redness or signs of a pressure wound forming. So shoulder blades, sacrum, butt, heels, elbows. I see no redness, no signs of a pressure wound forming. So you can come back over for me. And I'm just going to pinch a small piece of skin on the clavicle. Test for skin turgor. Okay, there's no tenting noted, so my patient is well hydrated. Now I'm going to lower the bed back to the lowest position for patient safety. And I'll place the call bell right next to him. How has your stay in the hospital been so far?
Good.
Okay, do you have any questions, comments, or concerns for me?
No.
Okay, so I'm going to let your doctor know about the pain that you're in after the pain medicine that you received 4 hours ago to see if we can get you any more. And then I'm going to let him know about your vital signs so we keep monitoring those. And if you need anything, use your call bell and let me know, okay?
Okay. Thank you.